Hi, my name is Chase, and welcome to the Wellness Center podcast, where we're going to talk all things red light therapy. Thank you so much for tuning into this episode. Please make sure to like and subscribe so you can get updated and notified on all of our newest episodes that we'll be releasing. Have a great rest of your day and enjoy the episode. Hey everyone, this is Chase. Welcome back to the Wellness Center podcast. Thank you so much for tuning in today. I really appreciate it. If you notice, I have yellow light glasses and a buzzed head. Had a fun Thanksgiving holiday. If you know, these are my blue light glasses. They just help with headaches. And my head got buzzed because me and my wife were trying to cut it, and we're not professional barbers, so kind of botched it. So we buzzed it, and then when we tried buzzing it, botched it again. So we had to buzz it even shorter. This is my hair now. I actually really like it. I hope you guys had a great Thanksgiving weekend. I hope you had way more turkey and pie than you probably should have, and everyone with your family was really welcoming, loving, and inviting. I know that I actually came here to the Wellness Center a couple times and did some anxiety to peace protocols to help me with some of the anxiety that I get with dealing with my family and in-laws throughout the holiday season. But yeah, so we're going to get into it today. We are going to be talking about Parkinson's disease. I want to start touching on some bigger issues that people see. So I'm going to get right here to sharing my screen. Now, we're going to talk specifically, we're going to do a couple of things. We're going to talk about what Parkinson's is. We're going to talk about some at-home remedies. And then we're also going to go over a study, just like I do with my other podcasts, where we're going to look at the results of photobiomodulation therapy and how it helps. So Parkinson's disease, I'm getting this information from Parkinsons.org. And now just so you know, guys, if I'm looking over this way, it's because my computer screen's over here and that's where all my information's coming from, and my camera is right here. But Parkinson's disease is a neurodegenerative disorder. So your nerves, means your nerves degenerate over time, that affects predominantly the dopamine-producing neurons in a specific area of the brain called the substantia nigra. Now, again, big thing I got from that is it stops producing dopamine. Dopamine is one of the 4 happiness drugs, and I believe the 4 are dopamine, oxytocin, serotonin, and norepinephrine. So again, but yeah, neurodegenerative disorder. Now the symptoms, they develop slowly over years, is what it says right here. The progression of symptoms is often a bit different from one person to another due to the diversity of the disease. People with Parkinson's disease may experience tremors, slowness in the paucity of movement, limb stiffness, gait, and balance problems. So those are the more common issues that you see. In a different, on top of that as well, you can also see some movement-related symptoms. There also may be unrelated to movement, non-motor symptoms. And so it says here that people with Parkinson's disease are often more impacted by their non-motor symptoms, things that can include depression, anxiety, apathy, hallucinations, constipation, hypotension, sleep disorders, loss of sense of smell, and a variety of cognitive impairments. The cause remains largely unknown, so not a lot of people know, but they speculate it's a combination of genetics and environmental factors. So like if you're a steel worker and you grew up working in a steel mill, or if you're a coal miner, smoker, I mean, any of those things can potentially be a factor to develop Parkinson's disease. People who fight, people who have addictions that they're working through, all that kind of stuff. And unfortunately, there's no cure for Parkinson's disease that we're aware of yet. There are many treatment options, things like medications, lifestyle adjustments, and surgery. And that's what they say here on the Parkinsons.org. Now, let's get right into the study here. This was done by BMC Neurology. This was published on the 2nd of July back in 2021. And it talks about photobiomodulation and Parkinson's disease. Now, the objective was to see if photobiomodulation could mitigate clinical signs of Parkinson's disease. Now, the method, 12 participants with idiopathic Parkinson's disease were recruited. 6 were randomly chosen to begin 12 weeks of transcranial, intracerebral, neck, and abdominal photobiomodulation. So everything from the shoulders up, more or less. The remaining 6 were waitlisted for 14 weeks before commencing the same treatment. After the 12-week treatment period, all participants were supplied with a photobiomodulation device to continue home treatment. Participants were assessed for mobility, fine motor skill, balance, and cognition before the treatment began, after 4 weeks of treatment, after 12 weeks of treatment, and the end of the home treatment period. And then it looks like they used a Wilcoxon signed rank test was used to assess the treatment effectiveness. Now the results, it says mobility, cognition, dynamic balance, and fine motor skills were significantly improved with photobiomodulation treatment for 12 weeks and up to 1 year, which is crazy. Many individual improvements were above the minimal clinically important difference, the threshold judged to be meaningful for participants. Individual improvement varied, but many continued for up to 1 year with sustained home treatment. There were a demonstrable Hawthorne effect that was below the treatment effect. No side effects of the treatment were observed. So a couple things I want to point out here that I think are really, really powerful here. 12-week treatment period. This takes time. This is not a miracle drug. It's not a one and done. I know I harp on that sometimes, and I'll continue to harp on it on all. I just punched my table. It's not a one and done. This is not a miracle drug. This is not a fountain of youth. It takes time. You know, if you guys, I don't know if I've done one on this yet, but we have a study about autism that people who do autism, like a protocol, the red light therapy for up to 2 months, can see significant improvements in autism-related symptoms for up to a year of time. So it seems very similar with this Parkinson's disease I'm referencing over to the computer screen here, which is absolutely crazy to me. So the conclusion is to be a safe and potentially effective treatment for a range of clinical signs and symptoms of Parkinson's disease, which is really cool. Now, there's one thing I do want to point out here. Now, I'm just kind of scrolling through the actual scientific study as well. Now, where was it? I don't think I see it here, but this talks about the treatment protocol. So it was administered, let me just scroll through this really quick. 3 times per week for weeks 1 to 4. 3 times a week, that's what our introduction package is. It's 1 session every other day for 2 weeks, 6 sessions in total. Now, one thing, it doesn't say here that I am probably scrolling past really quick, is that with Parkinson's disease, they measured it, and Parkinson's disease is produced in your brain at 20 hertz. And here at the Wellness Center, we actually have a protocol that pulsates light almost the entire time at 20 hertz. It's called our dopamine protocol. It's a really, really powerful protocol. And we've actually seen some people with Parkinson's tremors see a significant decrease in their tremors after doing these protocols. Now, of course, what are some at-home remedies or things you can do at home to help with Parkinson's disease? There's 6 on this site. I'm looking at the hopkinsmedicine.org, Hopkins. There's nutritional supplements that you can take, like CoQ10 or Q10. There's Tai Chi, which is a really balancing, really grounding form of movement. There's yoga, again, a mindful practice that can help with things. Massage therapy. Okay, there's your excuse to go get a massage. Movement therapy, so moving with like a physical therapist. There's also something out there called rock steady boxing, which is a form of boxing specifically trained or specifically meant for people with Parkinson's disease, which I've actually been a part of, and it's really cool. Not that I have Parkinson's, I was one of the coaches for it for a long time. And then acupuncture is also another modality to help with Parkinson's disease. Well, guys, there you have it. Red light therapy is an effective treatment for Parkinson's disease or the symptoms of Parkinson's disease. I would invite you guys to come in and try a free session. Your first session is always free. So please come in. You can reach us at 801-800-2484. We're located in South Ogden at 1724 East, 5600 South in South Ogden. You can also go to our website at www.thewellnesscenter.life. Thewellnesscenter.life. Guys, thank you so much for tuning in. Please make sure to like and subscribe. I hope you have a great rest of your day. I hope you have a great holiday season, and we'll see you next week. Peace.